constantly evolving, okay? We're gonna look at some theories here. Why isn't this doing this? Okay. So the theory of animism, okay? Good spirits brought to health, evil spirits brought sickness and death. Kind of how they thought in the early civilizations. Roles of nurse and physician were completely separate and distinct. The physician was known as like the medicine man, the person, and the nurse was just the caring mother. Okay, look how far we've come, right? We have female surgeons, we have male nurses. I mean, we have come so far in nursing. I worked with some nurses that would give up their chair to the doctor and light his cigarette. I remember hearing stories about that, and I just was like, oh no, I'm not doing that. It dates back to the ancient Greek civilization, where their temples became the center of medical care. Okay, nurses cared for the sick in the home and the community. There was practiced nurse midwives to deliver babies and provide gynecologic care. Okay, during the early Christian period, nurses' roles became more formal and more clearly defined. Okay, male and female nursing orders were founded. Okay, there was a shift in the 16th century, okay, from a religious orientation, okay, so only the religions, nuns would come out and be nurses, to kind of anybody. So the shortage of nurses led to recruitment, okay. They were short on nurses then as they are now, okay. There was low pay, long work hours, unfavorable conditions. Okay, my grandmother was a nurse in the Korean War, and she wore a kimono, and her job was to light the opium pipes for the injured soldiers. Okay, that was her job, is to keep their pipe lit and make sure their pain was controlled. Okay, I have those opium pipes at home, so I'm very proud about that. Okay, first question. I like to practice questions with you guys to kind of get you guys in the mindset of answering questions, because this is what you're going to do throughout your nursing career, okay? Is this statement true or false? In the beginning of civilization, the role of the physician was carried out by a medicine man, and the nurse was the mother who cared for her family during sickness. True, right? Below everything, I have rationales for you guys, so you'll be able to read why that answer was correct. Okay, it's really important to understand the rationale, okay, after every question. Looking back at the historical perspectives and how the roles changed of nurses, okay, nursing as we know it, based on many of the beliefs of Florence Nightingale. Does anyone know who Florence Nightingale is?
She was a nurse in the Crimean War, like I guess mid-1800s or something.
Yes. There was like some Netflix thing about her or something like that, I recall. I'm not sure. Okay. So Nightingale challenged the prejudices against women and elevated the status of nurses. Okay, so she really kind of formed our nursing practice. Okay. She established the first training school for nurses. She wrote books about healthcare and nursing education. Hospital schools organized to provide more easily controlled and less expensive staff for the hospital. Female nurses were under the control of male hospital administrators and physicians. Okay. During World War II, large number of women worked outside of the home and became more independent and assertive. Okay. There was an explosion in medicine, and technology broadened the role of nurses. Okay, every day we're growing in nursing. Okay, so efforts are directed at upgrading nursing education. And we have associate degrees, we have bachelor's degrees, we have master's degrees, we have doctorate degrees. Okay, so nursing education is endless for you. Okay. You could practice in a wide variety of healthcare settings. You could work in a school, in a clinic, in a hospital. You could work on a disaster response team in another country. You could work anywhere in nursing. You could work for a law firm. Okay, I have a girlfriend I graduated with way back when who works at a law firm during workers' comp. You know, follows people around on their vacation to Tahiti and takes pictures of them on their jet ski after their back surgery and says, workers' comp fraud. That's her job. That sounds fancy, okay? Nurses develop a specific body of knowledge, okay? You guys are gonna develop a whole new set of skills, okay? You're gonna conduct and publish nursing research. You don't have to publish to be a nurse, okay? If you have a doctoral degree, you do. Okay, I'm hoping to publish this December. But we're constantly participating in research and we're looking at things. And I guess my takeaway is as a nurse, your learning will never end. You are always gonna be learning something, okay? You wanna recognize the role of nursing in promoting health. How can nurses promote health? How do we think they can promote health? Education, good.
Being like a role model.
A role model. How? Give me an example of being a role model.
Like if you're telling people not to smoke, you probably shouldn't smoke.
So I shouldn't sit there with my cigarette and be like, "This is bad." Okay. Yeah, that's true.
Yes, I was going to say the same, being an example for our patients, you know, eating healthy, right?
Advancement like techniques, medical techniques.
Keeping up to date. Good job. All right. So looking at some definitions of nurses, and we're taking it way back here. I remember reading this at the beginning of the summer going, wow, it's been a long time since I've read this stuff. Okay. So the ICN definition of nursing is to promote health and prevent illness, advocacy, promotion of a safe environment, research, participation in shaping health policy, and education. This is the most important definition you will ever have to remember because as a nurse, we educate our patients. Hopefully by educating our patients, we can prevent illness. We are advocates for our patients, okay? Our patients come to us for help. We didn't go find them on the corner of, 7-Eleven and tell them to come into the hospital, okay? They came into the hospital seeking help, so it's our job to advocate for them. We promote a safe environment, whether that's making sure their room is clean and all the cords are picked up from the floor. They feel safe in the hospital. We participate in research and we're educating ourselves and we help shape health policy. Okay, there's a lot of bills out there now with nurse practitioners, one that just passed, where I can practice independently now without a physician. I can have my own practice if I want. Okay, it's huge for our patients to be able to have the access to care that they need. I'm sure everybody in this room has tried to get a doctor appointment and they give you one 6 months from now. And you're like, thanks, it's not gonna help me, okay? The ANA definition, so the American Nurses Association, is a social policy statement which basically says the same thing. If you guys join any associations as a nursing student, I would join the American Nurses Association. Okay, they give you research articles, there's fun things to read about, you get a massive student discount, it's pretty cool, okay? Looking at another question here, and these are NCLEX-based questions, so this is kind of stuff that you're gonna see on our exams and on the HESIs, okay? A hospital nurse works collaboratively with a primary care provider. That could be a doctor, a physician assistant, a nurse practitioner, social worker, physical therapist, and home health nurse to provide nursing care for a patient following an MVA, so a car accident, right? What should the central focus of care, of this care? What should be the central focus?
The patient.
Why the patient?
Because everything should be around the patient.
Everything in circles around that patient. My husband used to tell my daughter, the world does not revolve around you. Okay? Unfortunately, with our patient, the world does revolve around them. Okay? And it's very important that we let them know that they're important. Okay? So there's the rationale in case you want to read. Okay? Some cues and competencies that we focus on in nursing are patient-centered care. Everything revolves around that patient. Okay? Teamwork and collaboration. So the social worker, the physical therapist, the respiratory therapist, the pharmacist, even the housekeeping staff, everybody's working on the same page for that patient. Okay, no one's more important than the other. Okay, quality improvement. So you have people upstairs that are reading your nursing notes and determining whether or not what you're doing is standard of care. Okay, so there's constantly need for quality improvement. Safety, evidence-based practice. I expect every single one of you guys as nurses to work with evidence-based practice. Every decision that you make, every action that you take is based on evidence. Okay? We don't do something because we think it tastes good, right? We do something because it's been studied, it's validated, it works. That's why there's policy and procedures everywhere we go as nurses. Okay? Our aim as a nurse is to promote health, prevent illness, restore health by taking care of someone who's sick or injured, facilitate coping with disability or death. Okay? You guys are going to be experiencing situations in the hospital where someone is going to die. Okay? They're going to be disabled because of their injuries or their illness. Okay? And my hope is that through taking this class and working with resilience, we can learn how to develop some coping strategies. Okay? You guys will see and hear things that are not normal. Okay? When I was in nursing school, the thought was, best one's the next one. Get ready for that next trauma. Well, guess what? My glass is only so big, and I can only take so much. Okay? 25 years of trauma. I've seen a lot. Okay? No one told me how to cope with disability and death, and what I was seeing wasn't normal, because I'm not going to go home and talk to my toddler about what I saw. Okay? So we're going to learn kind of how to develop a resilience too. So I have a whole section on that. Okay? Some competencies that you guys will be expected to know are cognitive competencies, so memorization. Okay? Technical, so hands-on skills. Okay? Interpersonal, how you communicate with one another. Okay? We're going to learn about SBAR. Has anyone heard of SBAR before? Okay, so
Yes.
situation, background, assessment, and response, right? That was actually developed by flight attendants, believe it or not, in the aviation industry. It's been around since the 60s. That's how they communicate with the pilot and with one another, and now healthcare has adopted it in 2002 because it works, okay? Ethical and legal competencies are gonna be important as well. Another question for you guys. A nurse who uses critical thinking skills to develop a nursing care plan for an expectant mother of triplets is said to be using what skill?
Cognitive?
Okay, cognitive. Okay. So cognitive skills involve thinking about the nature of things sufficiently to make decisions regarding care. Some of the things that I would need to think about as the nurse with this expected mother of triplets, do I want to just give her a book and say, here you go? You know, can she read? Does she understand? Is she having stress? Does she need help? So you're thinking about where she's at mentally, okay? All right. We have many roles as nurses, okay? Oftentimes you hear them say, I'm not your social worker. Okay, do you have a question?
Yeah, I was just curious for that particular question.
Okay.
Why does it fall on cognitive and not interpersonal? Because I would feel like the social emotional component would weigh pretty heavily on that.
So interpersonal skills would involve caring relationships.
Oh, so just, like, I see.
Yeah.
So you're thinking about the social emotional.
So we have many different roles. We're a communicator, we're a teacher, we're a counselor, we're a leader, we're a researcher, we are an advocate, and we're a collaborator. You automatically advocate for your patients. Do you think it's okay to advocate for yourself as
Yes.
a nurse? Yeah. If they tell you to go take care of this patient that you don't understand what's going on with them, and you don't feel comfortable, is it okay to say I don't feel comfortable? Absolutely. Okay. So we're gonna promote health by identifying and analyzing and maximizing each of the patient's individual strengths, okay? Prevent illness, restore health, facilitate coping, disability, and death. This slide has been repeated like 4 or 5 different times, so you can almost expect that there will be a question on what is promoting health. Okay? Some factors that affect health: genetic inheritance. Okay? High cholesterol, that's genetic, right? Is diabetes genetic? Can be. Hypertension,
Mm-hmm.
anxiety and depression,
Yes.
addiction,
Mm-hmm.
okay? Cognitive abilities, educational level, okay? Race and ethnicity, culture can affect health. Everyone's got different practices. Age and biologic sex, developmental level, do they understand kind of what's happening? Lifestyle and environment, someone's socioeconomic status, do you think that impacts someone's health?
Yeah.
How? Resources, access to care, do they have food? Do they have money to pay for that prescription that they have? Okay? Health literacy. When we're talking to patients, and we'll work on this a lot in our skills lab, I don't want to start talking to you with all my medical jargon. Okay? I want to talk to you in words that you're going to understand. Okay? When you approach the patient, I don't want to say 56-year-old female, history of CVA, history of HTN, hyperlipidemia, I did a thoracotomy in the right intercostal space. I don't want to start talking that way to families. Okay? So you want to kind of break things down to words they'll understand. You know, your father has a diagnosis of hypertension, which is high blood pressure. Okay? When patients have high blood pressure, they're at risk for certain conditions. And so you kind of just bring it down a notch. Okay? Put it in words that everybody understands. When I went to nursing school, I remember seeing Healthy People Initiative 2000. Okay? Now we're up to 2030. Okay? These are guidelines that our government develops for health. Okay? These will be on the test. Okay? You attain healthy, thriving lives and well-being, free of preventable disease, disability, injury, and premature death. They say they're guidelines, but I think they're really goals, okay, where they want our healthcare system to go. They want to eliminate all health disparities. Okay, Germany just developed a stem cell that they can inject in someone's liver to rid children of diabetes. Okay, I just read that research article and I'm very excited about that. Okay, so it's amazing what's happening with research. We want to achieve health equity. We want to make sure everybody has access to care. Do I care if the person is a citizen or not that comes into my hospital that needs treatment? No. They need help, so we're going to help them. Okay? We attain health literacy to improve the health and well-being of all. Okay? We create a social, physical, and an economic environment to promote attaining full potential for health and well-being. And we promote healthy development, healthy behaviors, well-being across all life stages. When you were little and you went to the doctor, and your parents sat with the doctor and they go, they're in the 98th percentile. And they kind of look at this map and say, this is where you should be. Okay? They're promoting healthy development, healthy behaviors. And then they talk to you about having your kids make sure they exercise, make sure they're eating all the colors on the plate, vegetables, breads, pastas, whatever. Okay? Preventing illness would mean reducing the risk of illness, promoting good health habits, maintaining optimal functioning. Okay? We prevent illness, you guys said it, by teaching and setting a personal example. I don't want to be the respiratory therapist that shows up with a cigarette lighting your albuterol treatment. That sounds kind of weird. Okay? We have educational programs for like prenatal care for pregnant women, smoking cessation programs, stress reduction seminars. Okay? There are community programs that nurses can lead and give resources. There's literature, TV, radio, internet, information about healthy diet and exercise and good health habits. Health assessments in institutions, clinics, and community identify deficiencies and increase the strength and decrease the risk for end illness, okay? Health assessment is something that I find very near and dear to my heart, so when we start doing health assessment, I'm gonna be hard on you guys, okay? I'll tell you a personal story. My grandmother died because of a health assessment gone wrong. It was a preventable death. This was a healthy 86-year-old woman who was still driving her car and living alone that tripped and fell and hit her head on the corner of a bathroom sink. She had a cut on her head. She called 911. 911 took her to the emergency room. The nurses and doctors were so focused on the cut on her head, they missed the bruising on her abdomen, and she died from a shattered spleen. That is a preventable death. Had that nurse or doctor undressed their patient and properly examined her, they would have found the bruising on her abdomen. She didn't have a head bleed. She didn't have a skull fracture. She had a 1 centimeter laceration on her forehead. So I am 100% compassionate about health assessment. I will make sure you guys do a good health assessment. Okay? All right. So we provide direct care to the person who is ill. Do we also provide care to the family or friends? How do we do that? Consoling them. You include them in the plan of care. Oftentimes hospitals, when they do rounds, they do family-centered rounds, patient family-centered rounds, where the whole team will come to the bedside when the family's there and we'll talk openly about what's happening. They do a lot of that on pediatric wards and critical care units, okay? We're gonna collaborate with other healthcare providers. Maybe the social worker knows something I don't. They always find out the dirt. They know the Facebook status, Instagram post, and what's happening with that patient before the nurses do. Okay, I always read their notes. Always read their notes. Okay? Planning, teaching, and carrying out rehabilitation for illnesses. As the nurses, it's not the physical therapist or occupational therapist's job to ambulate your patient or to do exercises with your patient. It is your job. If you're in clinical with me, you're going to be walking that patient. We're not waiting for physical therapy. That is a basic nursing skill. Okay? Nurses work in mental health and chemical dependency programs. Okay? When we facilitate coping with disability and death, we maximize a person's strengths and potentials by teaching. Okay? There's referrals to community support systems. There's debriefings where we can meet and talk with everybody. You can do them in public or in private. Everybody's gonna process stuff differently. Okay, for me, I like to go out in my garden and rip up everything and replant it. My husband says it's cheaper than drugs. I said yes. So he just lets me do it. Okay? We all develop our own coping mechanisms, okay? Providing high-end care. The care that you provide, I want you to think about it. Would you want your family member, your best friend, being cared for that way? How would you want them being cared for? So when you're treating your patients, I treat my patients like they're my family. And I don't like my mother-in-law, but I still will treat her well. Okay, my monster-in-law. So you treat everybody the same, okay? Here's another question, true or false? A nurse who explains a surgical procedure to a patient in order to obtain informed consent is fulfilling the role of a counselor.
False.
Why is it false?
Because who's doing the role of an advocate for that patient? Having the informed consent to be signed.
Excellent. First of all, a nurse will never have a patient sign a consent for a surgical procedure. That's a doctor's job. The person doing the procedure should do that. Oftentimes a doctor will be like, oh, have them sign consent for me. I'll be in the morning. Your job as the nurse is to say no. Because if you were going to be operated on or your family was going to be operated on, wouldn't you want to know what's going on? I don't know what technique they're going to use. I don't know what kind of anesthesia they're going to use. Do it yourself, you know? As a almost 30-year nurse, I'd say that. Brand new nurse, I might be like, might be a little nervous, okay? So a nurse who explains a surgical procedure to a patient in order to obtain informed consent is fulfilling the role of an advocate. Okay, so that nurse needs to tell the doctor to have it signed by himself. Okay. As a professional discipline, okay, we have a well-defined body of specific and unique knowledge. We went to school, we learned how to be a nurse. Not everybody can do that, okay? Strong service orientation, we want to give back, okay? We, by nurses, like to take care of people. That's what we do, okay? We wouldn't be here if we didn't, okay? We follow a code of ethics. The Nursing Code of Ethics is available to everybody on the BRN website, the Board of Registered Nursing. You can read about the Code of Ethics. We have a moral and ethical responsibility to care for the sick and injured patient and family members. Okay? We realize our own bias before we walk into the room and we acknowledge it. Okay? Professional organization that sets standards. So the American Nurses Association is one of them. Okay. Autonomy and self-regulation. Once you get further along in your nursing career, you'll follow something that's called standing orders. And you won't have to ask the doctor for help. They say, this is what I expect in this condition, and you feel comfortable doing it. Okay. Nursing educators, they work in the hospital, they work in the classroom. We have a responsibility to form the professional identities of the students. My job is to teach you guys, okay? I'm not gonna teach you not only nursing skills and the history of nursing, but how to be a good nurse, okay? That's my job, okay? When you graduate, I'm not gonna say if successful, when you graduate, you guys will be nurses, okay? I will be proud to say that I was your teacher, okay? So some preparation for nursing practice we talked about before, associate degree. They have diplomas in nursing, baccalaureate nursing, graduate nursing, continuing education, which is something that you guys will do as nurses. Okay, I've never done this, but they have like cruises you can go on for CEs. I have to do that sometime, okay? You're constantly doing something for your education, and they always try and make it fun, okay? In-service education in the hospital, when a new piece of equipment comes in, they want to teach you how it works. You'll be participating in that, okay? These are some organizations. I mentioned one already, the American Academy of Nurses, okay? The International Nursing Organization, American Nurses Association, I think is what's more applicable to you guys as nursing students. National League of Nurses is also good. American Association of Colleges of Nursing, so the AACN is also a good one. These are all different organizations that all say the same thing about nursing, but they give us a lot of information, educational opportunities, okay? How many of you guys have heard of the Student Nurses Association here at COM? How many of you guys want to join? Every hand should be up. Okay. I won't blame you for the ants next year. Okay. But the Student Nurse Association here at College of Marin gives nursing students a voice. Okay. You're out in the community. Okay. You guys tell us as instructors what you guys need. Okay. You guys lead the path for the other future of nursing. Okay. Nurse Practice Acts. There is a legal scope of nursing practice that you must follow. The Board of Registered Nursing has a 17-page document that says exactly what you can and cannot do as a registered nurse. I don't want you to memorize it, but I want you to know where to find it. Okay, so when you're in practice and I tell you to go put in a chest tube in somebody, you can say, it's not my scope of practice. Okay, you guys need to know what your scope of practice is. Okay, as first-year nursing students, just glance over it, read it, have that page saved because you will need to look at it one day. Okay, you create a state board of nursing to make and enforce rules and regulations. That's the Board of Registered Nursing in California. Okay, We established criteria for nursing education and licensure. So the Board of Registered Nursing for California says all associate degree programs must have X, Y, and Z. Okay, we're currently in the process of credentialing our school here for accreditation, and we're doing a lot of work to make sure that we're up to par, so you guys can be at a credentialed school. Okay?
Question.
Yes.
So that is the California Board of Nursing?
California Board of Registered Nursing, brn.gov. So guidelines for nursing practice moving forward. Standardized nursing practice. Same thing, what you can and cannot do. Code of ethics, we have a code of ethics. If a patient is requesting pain medicine and it's their 15th time in 10 minutes, is it really ethical to give them a squirt of saline? No. Okay, we probably should educate them about pain. Probably the medicine they're getting is not working, and really kind of delve deeper into what that situation is. Okay? All right. Which of the following establishes criteria for education and licensure of nursing? So, nursing process, Nurse Practice Acts, the ANA Standard of Nursing Practice, or the National League of Nurses? It's B, your Nurse Practice Act, which is on the Board of Registered Nurses. Tells you what you can and cannot do, what education you need for whichever licensure you are going to get, whether you're a licensed vocational nurse, a registered nurse, an advanced practice nurse, everything is on there. Okay? Thoughtful person-centered practice, person-family-centered practice. Okay, we care for everybody. Okay? This is assessing your patient, diagnosing them, identifying the problems, coming up with a treatment plan. You're not going to be able to, tell them exactly what their diagnosis is, but I expect you to assess your patient and tell the provider that their lung sounds are wet. Tell that you are the eyes and ears for that provider. You're with the patient for 8 to 12 hours. Me as the provider, I roll in 30 minutes in the morning, look at your brief notes, and walk away. Okay? I expect the nurses on the ward or in the hospital to be the eyes and ears for the patient. Okay? So the top trends to watch for in nursing education, so there's some top trends, this will not be a test question. Changing demographics and increasing diversity, technology explosion, globalization of the world's economy and society, the era of educated consumer alternative therapies, shift to population-based care, the cost of health care. Has anyone heard of, what is it? Universal health care. What do you guys think that is? Do you think it's beneficial or not?
Yes.
Okay. Why?
Everyone deserves access to
So everyone deserves access to care, okay, regardless, okay? If you go into anybody can go into any emergency room and they can get emergency medical care to stabilize the patient, okay? That's like our country's form of universal health care. And you can just come and get treatment. That doesn't help, right? All right, so I'm gonna skip over these are not important. Self-care is one of the most important things you guys can do. Take care of yourself, okay? We owe the same duties to self as to others. You come first, just like in the airplane when the flight attendant tells you to put on your oxygen first instead of your babies. You need to take care of yourself first before you can take care of others, okay? The ANA, so the American Nurses Association, defines a health nurse as one who's actively focuses on creating and maintaining a balance. Do we think everybody follows that and takes care of themselves in nursing?
I don't know.
No. Okay. It's not our job to police the nurses and say, you need to go see a therapist. You need to take up gardening. Okay? It's important that you realize, hey, I may need to talk to someone about this. I may need some help with this. The only job you have is just to speak up. That's it. And then someone, hopefully, will help you. Okay. Signs of fatigue in the nursing profession. We see this every day. The burnout rate for new nurses right now, a recent study just published by Stanford, is 5 years. Think how hard you guys have worked to get here. All the prereqs, everything you've sacrificed to be a nurse. And then you work for 5 years and you're like, I'm out. Okay? Compassion fatigue, burnout, secondary trauma stress. What do you think that is?
Being exposed to traumatic events.
What we're seeing is not normal. Okay? We can't see some of this stuff on TV. Grey's Anatomy, fine, but not all of it. Okay? It's where resilience comes in. Okay? I attended an ethics conference in March that talked about resilience, and Dr. Patricia Rushton from Harvard published a Nurse Practice Act on the East Coast that focused on nurse resilience. It was like millions of dollar grant that she got. I'm hoping to have that here, but I have to work with her later. Okay? So resilience is an individual's aptitude for overcoming an adverse life circumstance. I like that, with a hopeful attitude. Okay? I don't know about that. Utilizing healthy internal coping mechanisms. Okay? Not gonna lie, some people I've worked with need a bottle of wine to go to bed. Some turn to drugs. Nurses in our profession are at a higher risk of developing a behavior that's not good. Okay? But I want you to be mindful of that. Okay? Utilizing external resources such as supportive work environments. Not all work environments are supportive. Guess what? The nurse's station is a hen house. No matter where you work, there's drama. There's drama everywhere you go. Okay? You'll find your close-knit friends to be able to count on. Family members you can count on. Instructors, peers, anybody that you can count on to help with stress. Okay? You'll also develop assertive communication skills, so being able to speak up. I am having a hard time with this. I need to talk to someone about this. It's not normal. Okay? All right, let's take a little break and come back. We'll finish up 2 and 3 and then probably call it for the day.